Welcome to Boombostic Health, where we challenge the business of healthcare and explore bold ideas that drive meaningful change. Each week, we bring you candid conversations with top experts, innovators, and leaders, exploring the latest trends and technologies shaping the future of healthcare. Join us and be part of the conversation in transforming healthcare.
Welcome back to another episode of Boombostic Health in the Wild here at Health 2025 in Las Vegas. I am joined by James York for episode 55 here. James is the Chief Commercial Officer and Head of Government Affairs at Molecular Testing Labs. Thanks for being here, James.
It's my pleasure. Thank you for having me.
So we were just talking about you're in from Dallas and you're an owner of this lab.
Yes.
And on the weekends, you spend a lot of time at baseball diets.
We're going to start off with some small talk.
Might as well.
In an area that I love to talk about.
Yeah.
So I have 17-year-old twin boys, and one of them has made a pretty big commitment to baseball as like his passion.
Which means you also have made a pretty big commitment.
I'm the financial backer for this endeavor.
Yep.
It's very costly. So I'll tell you a quick little story. There's moments in life where you're proud of your son. So my son has been getting better and better and better. And the other day he calls me up and he says, "Hey, Dad, will you take me to a tryout?" And I said, "Okay, yeah, you're on a team right now. What tryout are we going to?" And he said, "I reached out to this coach of a national scout team. And he looked at my videos and I have a tryout tomorrow. Will you take me?" So I took him. So he's now on a national scout team that is like an invitation only tournament team.
That's amazing.
It's incredible.
So tournaments all over the country?
All over the country.
Okay, so the financial support just went to another level, but it's fun to do that. It's worth doing that when they're working hard.
So Dad needs to sell at molecular testing.
Right.
I need to sell hard. I need to grow the business. Yeah.
Well, hey, our audience appreciates the fact that, look, we're all pursuing innovation in healthcare and we're all human and we're all out here, trying to make the world a better place. And clearly with molecular labs, what you're building is intended to make it so that testing's more accessible and that we're more proactive and preventative with healthcare. Is that fair? Like, do you want to just kind of give us a little bit of understanding of that?
You could sell for us, Bradley. Yeah.
Okay.
So our core belief at the company is that everyone should have access to diagnostics or testing, no matter what their situation or circumstances are. And so there's like the founders of this company have a long history of running semiconductor and solar panel companies abroad, internationally. And when they would come back to the US, they couldn't get testing. And then when you start to dive into the US healthcare system, we cliche, but people talk about it being broken all the time. And I think, well, maybe we could debate that, but I think in general, nobody would debate that it just doesn't work for everybody. Diagnostics is a flywheel. It's a front door and it's a top of funnel. No matter how you look at the business, that it's a way to activate patients. So sometimes if you can just get diagnostic information, you can destigmatize it. You can make it more convenient. Then people can get better access to diagnostics that wouldn't otherwise have it. And then you can actually create care journeys off of that. And so for us, it's like, I'm going to anticipate one of your questions about what's my excitement of being at Health. For me, we've never had a diagnostic zone.
Right.
And what a signal. I've devoted 12 years of my life to this mission to increase access to diagnostics. And the fact that there's a diagnostic zone at Health now indicates its importance for activating patients. So couldn't be happier. This feels like kind of a missional dream come true for us. And we just want to continue to figure out how do we deploy testing that empowers other people's strategy to activate their own patients.
It's interesting. A lot of people don't recognize that without the right diagnostic, there really is no treatment that can be provided. You have to know what the diagnosis is and what kind of therapeutic goes along with that diagnosis. So companion diagnostics is sometimes the term for that.
Yeah.
It sounds like what you've been doing at Molecular Testing Labs is going after these certain types of care pathways where you can make the diagnostic more accessible And that ends up creating this opportunity to get ahead of a given disease. Is there a good example that you see that has been significant? And also, could you talk about this latest announcement with Abbott? Maybe those two are kind of two-part question.
That's great. Yeah, so I'll give you some data to start out with. Okay. The CDC says 70% of all clinical decisions are based off of a lab. And when you look at the spend across the entire healthcare ecosystem, only 7% of the spend is spent on labs. What does that tell you? Like, there's a lot of insights that you can get from those two data points. Lab testing is severely under-indexed for the healthcare spend, which tells you that the incumbents of healthcare don't generally think about the need to innovate it. They generally think about it as, we have Quest or Labcorp, so we're good. And now, like, Quest and Labcorp are incredible companies. They do what they do really well, which is, in my mind, is support traditional healthcare pathways. But what this, I guess, conference in general speaks to is the need to change a different pathway or to create a new pathway that supplements the care that's not occurring. So to your question, how do we get here and what do we focus on? In 2015, we started with HIV and STI testing. And the reason that we started there is because we wanted, I guess we're like gluttons for punishment. Like, we wanted the hardest use case that you could find. So we went and started to identify in the market where's the biggest need for testing and access to testing, and what has the most significant barriers to it. And HIV and STI testing became the obvious choice. We surveyed the market. One of my co-founders called over 2,000 people and spoke to them directly about when's the last time you had a test, what prevents you from having a test, etc. And we found these massive barriers. We went to the CDC and talked to them about, hey, what do you think about at-home testing models? And the leadership at the CDC at that time, this goes back to 2015, said, we have better access to testing than we've ever had. We have better sensitivity and specificity around testing. We have the best access to healthcare that we've ever had, and yet the prevalence rates for STI continues to climb. That tells us we need to be able to throw everything at this that we possibly can. So voila, that was our use case that we decided to launch into, was HIV STI testing. When you fast forward to last year, we supported over 5% of all the nation's HIV testing on a self-collected dried blood spot farm. Okay. So fast forward a few years to 2018. We created a PrEP panel. Are you familiar with PrEP?
Yeah.
Okay. So for people in your audience that don't know what PrEP is, it's an oral medication. It is highly effective. If you take the oral medication, you're not going to contract HIV. The problem with PrEP is that there's significant barriers like stigma and mistrust in the populations that need that medication. And there's a lot of lab testing that is required for providers to prescribe PrEP. And so you had the double whammy effect where you had a market that has high mistrust, high stigma, high lack of convenience, high geographic and financial restrictions. And then you have this high bar for testing that prohibited a lot of people from uptaking and staying persistent to PrEP. And so what did we do to solve that? We allowed teleprep providers to actually empower their strategy, so it didn't require their patients to go into a patient service center anymore. They could take their testing at home in a discrete setting. Okay. So what happened there? Gilead grew the PrEP market by 35%, which was all attributable to testing and just making it easier to do. Okay. So that's kind of like the state of the state on that in terms of like our best use case where we identified, if you do this, then this will happen. The big news for us is this year, Abbott, which Abbott is an extremely trusted brand in the healthcare market, specifically around the diagnostic market.
Headquartered in Chicago.
Headquartered in Chicago. COVID happened. Abbott was, I mean, they showed up when the nation needed testing. Abbott was one of the biggest, best rally points in the market, if you will. And so Abbott became an at-home testing brand, right? And all of a sudden,
That's right. Yeah.
all of a sudden, Abbott created this market where households were talking about the differences between rapid testing and PCR testing. And so when you have people sitting around the dinner table talking about PCR testing, that's a pretty good thing for our business. Anyway, they submitted to the FDA a multiplex test kit where people can collect their own sample at home through a collection of urine or swab and send it off to the lab and determine if you have chlamydia, gonorrhea, trick, or MGen, which is the only test on the market now that you can do that with. It has FDA clearance on it, which is another big leap forward because people want to know that it's safe and it's accurate. And with that FDA authorization, you can pretty much validate that it's both.
Right.
So we've launched that this year. We have a few launch partners in the market now that are starting to collect those samples and send them back, and we're getting some great data from it.
Okay, excellent. Yeah. And Abbott is one of those partners?
So Abbott is the manufacturer.
Yeah.
The test requires a lab.
Okay.
The significance of that is you can do rapid testing with chlamydia, gonorrhea, for example. The problem is you lose the data. And so on rapid test, which is somebody collects a sample at home and gets an instant result,
Data doesn't get collected.
you're requiring the patient to self-report.
Right.
And that doesn't always happen. So you lose some integrity in the data.
Okay, I see what you're saying.
When they take the sample and send it back to the lab, one, you're getting a lab quality result. Two, there is an authorized provider. It can be asynchronous or it can be synchronous, but there's an authorized provider in the loop that is saying, I order this test for this person for whatever reason that they determine is medically necessary. And then when we result it, we're resulting it to the patient. We result it to the provider so that they can link the patient to care and give them options and consult for how to treat the infection. And if it's a detected infection, we also report those results to the local health jurisdiction. So you're getting all the surveillance data within your public health asset base.
Okay.
So it's a win-win-win all the way around. And it's just a really great opportunity for like testing, screening programs and thinking about preventative care.
But for clarity, your lab,
We are a lab.
performing that testing and that exam.
That's correct.
And
Yeah,
then you're capturing all the data and making sure it's fully reported.
100%.
Okay.
Yeah.
Interesting. So where does this go? Like we talked earlier about the preventative nature of these kinds of tests, and there's a long-term view I'm sure you have on how your business grows, but also how healthcare continues to become more effective. What do you see in your crystal ball, I don't know, a decade from now in terms of how healthcare will change based on diagnostics?
Oh, I love that question. Well, I didn't mean to talk about STI testing so much here. And so let's expand where we can go with it.
Yeah.
Just because HIV, STI, and PrEP testing was our starting point is certainly not our finishing point. It's not our finish line. What we're focused on is taking the most routinely prescribed test and making them validated on self-collection modalities.
Okay.
And so since 2018, we've been expanding our test menu into chronic disease management, like HbA1c, colorectal cancer screens, kidney dysfunction. We've also been expanding our test menu into wellness markets like hormone testing. I think we're the only lab in the world that I'm aware of that can do testosterone, progesterone, estradiol, DHEAS, LH, and FSH on dried blood spot. The importance of that is dried blood spot is an extremely stable sample time. And as we know, like, I don't know if you saw Trump's announcement recently about making fertility medications more accessible and more affordable. Like, man, what a great indication for our testing for that. Like, people that have barriers to care, cost being one of them, where we can say, we can do this test for you at this fixed cost, and you know exactly what it's going to cost you, so you can decide, do you want to engage or not? I think one of the biggest problems with healthcare is that so often the fee structures are opaque and people don't know what it's going to cost them. So if you have a $5,000 or $10,000 deductible, like, you don't know if you're willing to engage because you don't know what it's going to cost you.
Right.
And so, like, to answer your question is, it's like, focus on the most routine testing, focus on the areas that are the most stigmatized, like weight gain and fatigue. People don't want to talk about, why are they gaining weight, or why do they always
Make
feel
it more
tired?
convenient to do these kinds of tests in a more discreet way so that you can have the benefit of the
100%.
treat.
Yeah. And if you do that, like, here's the big aha moment, I think, is that the general nature of healthcare historically is very paternal. Like, come to your doctor so they can tell you exactly what to do. I think in the next 5 years, you're going to see a significant shift into patients taking more of a decision-making role in their own care journey.
Yeah.
Which, going back to health conference, that's what this is about, is everybody is like-minded. Everybody is in the room saying, okay, well, maybe there's not this, nobody wants there to be a catastrophic reset in healthcare, but I think everybody wants to create a different pathway for how people can get into care. And so I think what you're going to see is a lot more acceptance of these models where patients become the decision maker. They can guide their own journey. AI is obviously huge. I was hoping I could go a whole podcast without saying AI, but like, the reality is, it's like, people are going to build their own avatars based on their own liking and who they trust. So if I'm a 48-year-old white male and I want to talk to a 48-year-old white male doctor, I can do that. If I'm an African-American female and I want to create an African-American female avatar, I can do that. And I can have them speak at whatever language, whatever age reading level that I want. And so, like, a big, a big leap in where we're going is going to be driven by AI, like it or not. And it's just going to be able to compute so much more, so much faster.
Yeah.
So that you can say, like, this is the first time we're going to be able to imagine you could take a whole genome, you could take all the biomarker testing, you could take the wearable data, you could take the health records, and like, what else do you want to put into that, and compute everything so that you're legitimately forecasting health like you forecast the weather.
Right.
You would have that many data points involved so that you could predict outcomes and reduce, like, this issue of catastrophic health concerns.
Yeah. Well, what you remind me of, in our Health Cloud Capital portfolio, all of the work we do is to create this signal based on that constellation of information that historically people haven't had enough time to really go through. And even if they did, being able to recognize these patterns and do regression analysis, years or decades back, it's just not possible for a human to do.
Yeah.
But now that we have the power of these new technologies coming to healthcare, we can actually see that entire picture, as you're pointing out, with all these different data sets, whether in our world, it's lab data looked at over your entire life journey, or it's medical device data mined in a way, including the physician's notes, that historically could never have been done because they were unstructured and impossible to go through at scale.
Yes.
Or with medications, which candidly, there's a lot of focus at this conference and elsewhere on eliminating waste out of the pharma chain of how drugs get purchased and getting people on the cheapest drug. But to your point about the cost of the lab and the budget for the lab is such a tiny amount compared to the impact. It's the same thing with prescribing, except it's a bit nuanced in that the drugs that are being prescribed that are less expensive, it doesn't really have any, it's nowhere near as impactful as getting people on the right drugs and driving down the medical costs. So if you're on the wrong pill, even if it's the cheapest one, and you end up in the ER one time, that blows $7,000+, which is way more than any pill you're ever going to buy.
Yeah.
But I think with AI, I'm seeing it firsthand in our companies. you actually can have these agents that are doing that kind of work and ensuring that you're getting people on the optimal medication. And that's what I hear you talking about with respect to your future view of diagnostics and leveraging these. I like how you described it, providing tests to people that they can use discreetly for stigmatized kinds of issues that they really feel uncomfortable walking into a doctor's office. Those people are these gaps in care that are walking around who, if they could be treated, could save themselves a lot in terms of having a better life, but also could save the healthcare system a lot.
No doubt.
I think that is the fundamental reality of how AI can power this in such a beneficial way. So it sounds like you guys are right in the middle and leading the way in this particular area.
Well, we're going to try. It sounds like you have quite a knowledge base on AI and what's capable of also. All right, you just gave me a lot there, so let me try to unpack a little bit.
We need to wrap it up in like 30 seconds. So sorry to open it up so right at the end.
And this concludes.
We could do a part 2 though sometime.
Yeah, that sounds good. Okay, I won't go into everything. Yeah, so data in is going to matter. It's going to matter a lot. Understanding genetic predispositions, understanding the biomarkers and how they're behaving, and understanding wearable technology and the data feeds into that. You can put together a pretty complete picture pretty fast. We can prevent adverse drug reactions, to your point. We can predict that people are going to have chronic disease. Like, that doesn't happen overnight.
Right.
And so the more out in front of that we can get, the more we can move the needle to preventative care, the better off for the health system. And I think that's what everybody in this room is trying to accomplish.
Right. No doubt about it. Well, it has been such a pleasure talking to you. Would love to have you back on in the future. So thank you, James York, for being here. The great work of Molecular Testing Labs. And thanks to everybody in the audience, Boombostic Health, for being here for another episode in the wild at Health 2025 in Vegas. We'll see you next time. Thanks.